brothers and sisters. My name is Dr. MARIAM. I'm one of the pediatricians and a member of the American Muslim Women Association physician board member. And we are here today to conduct one of our topics that were chosen, which is about seasonal allergies or allergic rhinitis. And I am a local pediatrician, work in Arlington, and I am affiliated with Medical City of Arlington as well. We are here today on the platform of AMWPA, conducting another educational lecture for all our community so we can improve our health. I will first like to tell you about the format of the program. First, we will start off by introducing our organization and that is going to be followed by our presenter, which is Dr. AASIA GHAZI, who is an allergist and immunologist who is in a private practice and sees patients, both adults and kids. She's both certified in both internal medicine and allergies and immunology. So let's go ahead, start our program. Dr. AASIA GHAZI.
Assalamu alaikum, everyone. Thank you for taking your time to attend today's talk. And first of all, I would like to get started with a beautiful verse from Quran, Surah Yunus, verse number 57, that eloquently expresses how Quran was sent as a shifa to a believer. Bismillahir Rahmanir Rahim. Ya ayyuhan nasu qad ja'atkum mu'izatun min rabbikum wa shifaa'a lima fi sudur wa hudan wa rahmatan lil mu'minin. Sadaqallahu al-aliyyul azim. Verily there has come to you from your Lord and a healing for the diseases that are in the chest and guidance and mercy for people who believe. I would like to take this opportunity to share a few facts about American Muslim Women Physician Association, who I represent. American Muslim Women Physician Association is a nonprofit organization. It was founded in 2008. It's a group of Muslim physicians, dentists, and allied health care professionals. This is our website address for in-depth information about us. However, I would like to share a few more facts about us. Our vision is to promote health, welfare, and education of women in our community. And we promote preventive medicine in our community. We have been providing merit awards to Muslim female students in medicine. And we have recently started a mentorship program for the Muslim pre-med students. I'm very proud to say that we have been very active during COVID-19 pandemic in educating our community and assisting with preventive care. We have provided masks throughout the multiplex on a volunteer basis. And our pre-med students have played a lot of role there. We have provided meals to frontline workers, apart from many other things that we do on a day-to-day basis. So getting started with my topic today, which is allergic rhinitis and avoidance measures. I have a few objectives today that I want to get those points across to you all, my friends. First of all, runny nose is not always hay fever. So I will share a few facts about that. And then we will talk about understanding the difference between allergies and infection. Then recognizing the impact of allergies and importance of appropriate treatment. Then getting proper evaluation by an allergist. Last but not least, learning the avoidance measures. So let's get started. So how does the runny nose start? What happens in a very simplified version? I don't want to be too scientific here, so I'm just simplifying it a lot. Those symptoms, like we have runny nose, stuffy nose, sneezing, they happen when there is a reaction, when there is irritation in the inner lining of our nose, our eyes, our throat. It causes the inner membranes of our nose or eyes, or for that matter, your throat, to swell and produce mucus. The medical term for this irritation, for this reaction, is inflammation, okay? And the rhinitis is the medical term for those symptoms. So a little bit background about runny nose. Now, our first objective, which is runny nose, is not always hay fever or allergies. So what else can that be? So those symptoms of nasal symptoms that we just discussed, the stuffy nose, the runny nose, the irritation, the sneezing, they can be caused by other medical causes as well. Like, for example, that you all know, like a common cold. If we have a common cold, we might as well have similar symptoms. There are certain other changes, like climatic changes. If it's temperature changes, humidity changes, they can also cause stuffy noses. Irritations in the air, like cigarette smoke, dust, smog, even strong smells like perfumes. People get runny noses from that too. Or you're at workplace, there are some fumes, you're working in in an environment where there are fumes or dust or something like that, like chemical fumes, that can also cause irritation of your nose. Medications like aspirin, Advil, ibuprofen, even blood pressure, some blood pressure medicines can cause those changes, the reactions in our nose. Very important point that I want to get across, that overuse of nasal sprays. I have seen this a lot in my practice, that sometimes people have, they're uncomfortable because of their stuffy noses. So what they do is they use Afrin nasal spray, which is over the counter, on a daily basis. So what happens, first few days, they get good benefit from it, but over time, the congestion gets worse. So we call it rebound congestion. So I discourage for all of you guys to use Afrin on a chronic basis. And sometimes spicy food. If you eat spicy food, you start having rhinitis. That's also runny nose, okay? So that's also the cause of runny noses. So it's not just the allergies. However, allergies being the most common cause, most prominent cause, most common cause for these symptoms, but there are other reasons too that can cause runny nose, okay? So that was our first objective. The second is understanding the difference between allergies and infection. So how can we tell them apart? Let me backtrack a little bit, because I think it's important to know how do those allergies start anyways? What starts this process? So Allah has given us a defense mechanism that we call immune system. It protects our bodies from infections by fighting with microbes. In addition to that, our immune system has also been armed with the capability to spot and fight against anything foreign, like a pollen in this case. But in some of us, the immune system overreacts to fight with this foreign substance, like pollen in this case, and causes us to have allergies. But the question arises, why does this immune system overreact in some people? Because everybody does not have allergies, right? So what happens actually? Those people who have allergies, they are born with those genes that have an imprint or a message or a code written on them, on their DNA, that tells their immune system to overreact to that foreign substance like pollen when they inhale that pollen. In other words, the genes that you have inherited from your parents are directing your immune system to overreact to certain substances. That is the basic, mechanism of causing those allergies. So I'm gonna give you an example. The two friends are going for an outdoor walk in a nice park. Okay, I just showed this in the diagram. One of them is miserable with nasal congestion, itchy nose, watery, itchy eyes, scratching her throat, runny nose, and just wants to go back. The other one is playing, having fun, having no issues. So both of them are in the same environment. Why is one being impacted, the other one is not? Because the one who's being impacted has that DNA from their parents that has that code written, that message written, that you're supposed to fight with this pollen. We don't like this pollen. So when this person inhales that pollen in their system, their immune system, the DNA gets alerted. Hey, a foreigner has invaded. So their immune system, their DNA tells the immune system to create a chemical cop, like IgE, we call it IgE. So that IgE fights with that pollen because it's not supposed to like the pollen. It fights with the pollen. That combat produces a lot of chemicals. Those chemicals cause mucus production, itching. Like one of the most prominent chemicals is histamine. And that's why we use antihistamines. Like Zyrtec, your over-the-counter Zyrtec, Allegra, they're antihistamines because a lot of histamine gets produced when this pollen fights with our IgE, our chemical cop. So a little bit background there, but this is an oversimplification of complex cascade of events that actually happens. I just oversimplified it. So what are the common symptoms that usually happen with allergies? Watery nasal discharge, blocked nasal passages, sneezing, itching, postnasal drip, loss of taste, facial pressure, pain. So it's not just regular nasal discharge, lots of things happening which can impair the quality of our life. Swelling and dark discoloration of skin below the eyes. We call them allergic shiners. I'm going to show you a diagram of that. Hoarse voice, congestion, popping off your ears, itching of your throat, mouth breathing, sleep disorders. It impacts your sleep. You're waking up multiple times at night because your nose is stuffy, you can't sleep. So daytime, you're fatigued, you're tired, and you have trouble doing normal activities. And how do we differentiate allergies from viral infections? That was a little bit background about allergies. Now, coming to our second objective, how do we differentiate allergies from viral infections like a common cold? So if it's a common cold, usually, it can produce a fever, but allergies don't produce a fever. So if you're having a fever, 101, 102, it's not your allergies. And usually with allergies, you'll have itching. Itching is a hallmark of allergies. Itching of your nose, itching around your mouth even, itching of your throat, eyes. And with cold, with infections, you usually have a sore throat. Allergies less often. You can, but less often. And if it's an infection, then symptoms will last for, like if it's a common cold or any viral infection, 10 days to 2 weeks, then it should go away. But allergies, they persist as long as the pollen is persistent outside. And infections can happen any season, but your allergies will have a seasonal trend. So whenever it's your season, you'll start having symptoms. Very important to discuss here, the seasonal trend. Why a seasonal trend? Certain pollens, they pollinate only during certain seasons. So they cause only seasonal symptoms. Why do we say seasonal allergies? Because certain, like trees, they only pollinate during spring. Tree pollen only pollinates during spring season. So when temperature starts warming up, like mid-Feb or late Feb, the pollen tree count goes up, peaks in March, and then comes down in May. And by March, our grass starts pollinating and peaks in May and dies down in July when it's pretty hot. And then once it cools down, we have beautiful days outside in August, September, grass pollen goes up again. Then we have our weed pollen, like ragweed. It starts pollinating in August and starts all the way to, and it is there, lasts all the way till November. Then we don't have respite during winter either. We have a winter pollen here as well, juniper, mountain cedar. So it's a tree pollen that blooms in winter. And it is at peak in December, January season. So all year round, we have something pollinating in the air, but we can recognize our symptoms that way. Hey, this is every spring I have symptoms. Every spring I'm having those runny nose and itchy nose, and I have to go to the doctor and get treated. What is going on? That could be a clue. Another thing, dust mite. Dust mite could also be a trigger for your allergies. However, it's an indoor trigger, but it's a year-round problem. So here I have shown certain trees, ash, sycamore, mulberry. These are all trees. They pollinate during tree season, the March season, March, April, May. Then the ragweed on this side, fall side, August, September, October. Grasses, May, June. And then mountain cedar, December, January. And a word about mold. So mold can be both indoor and outdoors. And the problem with mold spore is that it's present all year round. But there is a spike in fall. What happens in the fall season, we have so many dead leaves, they accumulate and they collect molds. And so these things are something that could help you differentiate and recognize that your symptoms are from allergies and not infection. The other important fact that would tip us that our symptoms are most probably from allergies, if we also have other conditions like eczema, like we have food allergies, or we have asthma, or we have like our sisters, biologically related family members like brother, sister, mom, dad, they also have similar symptoms. because of the genetic factor that we just discussed. So why is it important to recognize? Why am I saying this? Why do I want to make this point across, that it's important to differentiate your symptoms from cold, or you feel like every time I have those symptoms, I have an infection? Because we have seen this a lot, that when we have patients, they tell us that, hey, every spring I have to be on an antibiotic, or every fall I get bronchitis and I have to be on an antibiotic. This is what I want to tell you guys, that it's usually your allergies. When it's seasonal, when it does not have any other factors that we just discussed, it's your allergies. You don't need an antibiotic. You need to go to your doctor, discuss your symptoms, or be appropriately treated by your allergist, and then find out what you're allergic to and make a treatment plan. So no abuse of antibiotics with these symptoms. That's very important. Now our third point, recognizing the impact of allergies and importance of appropriate treatment. Why do we want to recognize that we have allergies? If these symptoms are present, they're allergies. Can we just leave them like that and just live with it? What is the impact? What is at stake? Okay, so because untreated chronic and worsening allergies can eventually cause you to have chronic sinusitis. What does that mean, chronic sinusitis? We have sinuses. Allah has given us those sinuses here, those empty cavities inside on our face, on our there's cheeks here, on the forehead, around our eyes. What happens is the mucus gets collected there. And when the mucus gets collected there, and also inside the noses, we started feeling the sinus pressure, the facial pain, the headache. We lose the sense of smell, and makes us fatigued, chronic fatigue. So chronic sinusitis, this inflammation in your sinuses, the mucus collection in your sinuses can make you feel tired all the time, can make you lose focus all the time. So it's important for this to get treated appropriately. Sometimes we form this mucus collection inside the nose. It forms those big time swellings. And we call them, medical term for those swellings is polyps. You can't smell when you have a nasal polyp inside your nose. And they block your nose. So this congestion inside the nose causes the nasal blockage. Now you're breathing through your mouth, especially at night, and especially with children, because they don't know how to express their symptoms. So at night, you see them snoring. It's very important for people who have kids. If your kid is snoring at night, is waking up at multiple times at night, you feel like they're gasping for breath. And what do? You take them to a sleep doctor and they diagnose them as sleep apnea. That's a misdiagnosis. They're having their mouth breathing through because of the congestion in their nose, because of the blockage in their noses. So something that could be helped easily. That's how important it is to recognize your symptoms. So fatigue, effects on quality of your life, cough, you're constantly clearing your throat. And the other thing that's very important to note is that if allergies are untreated, the same reaction that happens in your nose, in your eyes that we just discussed, can also then extend into your lungs. Lungs have the same lining as your nose. So that pollen can do the same thing, what's doing in your noses, in your lung lining. So you get mucus production there as well. You get inflammation there as well. And that is what we call asthma. So now you start having asthma. So that is the impact of untreated allergies. If you just leave them alone, let it be, and now you're having chest tightness, now you're having wheezing, now you're having shortness of breath, or you're having dry cough. Like, okay, I was wheezing in fall. Last fall too, I was wheezing, or I was having this chest tightness. What's going on? So now that's another impact of your allergies. Also, the other important thing to note is eczema. People have eczema and they feel like, well, my eczema is getting worse with each pollen season. Of course, it has an impact on your eczema too. If pollen allergies can make your eczema worse, even dust mite allergies can make your eczema worse. So here I have depicted those sinus cavities where you feel the pressure and the pain. And when they are full and packed with mucus. And here, what I'm trying to show is that when we have persistent nasal congestion, why do our ears feel a popping? Or why do our kids have multiple ear infections when they have allergies? So what happens, there's a connection between the ears and the nose. So we call that, there's a tube that connects the nose and the ears. We call it eustachian tube. So when the nose is congested, that tube is also congested. Because of that congestion in the tube, it just makes changes in the middle ear, in our middle ear, that causes fluid in our middle ear cavity. So that fluid can get infected. So we have middle ear infections, or sometimes there's pressure in your ears, you can't hear. This is a picture of the allergic shiners. This is, when you see your kids, if they have these dark discoloration of the skin underneath their lower eyelids, that's a clue. This kid is suffering from chronic sinus congestion. Let us take him to the allergist or your regular doctor. They can recognize those symptoms and treat the kid appropriately. Another thing in small kids, because they're not going to tell you about their symptoms. Hey, I have postnasal drip, or I'm stuffy. You'll see them doing this all the time. And we call it allergic salute, because you will see a crease on the top of their noses. And this is how you will see them. They've been doing this all the time, wiping their noses, and the boggy swellings inside the nose. So I was trying to get that point across, that if you leave your allergies untreated, it has big time impacts on your health, on your day-to-day life, on your quality of life. It's important to realize and recognize your symptoms and get treated. And then what do we do when you go to an allergist? They will get your information, your seasonal trend, your history, and all that. Try to differentiate between if it's allergies versus non-allergies, allergic rhinitis versus non-allergic rhinitis, with history, exam, and then testing. So what we do, I'm going to talk a little bit about skin testing. It's the most reliable way. If indeed your symptoms are from allergies, it's a reliable way to test and find out. So we just scratch your skin with the tip of a plastic needle that is dipped in this pollen. And before scratching the skin, it's dipped in the pollen, and we just scratch your skin. And it takes 15 to 20 minutes for the skin that is scratched to show a reaction. The reaction is like a mosquito bite, an itchy mosquito bite with redness of the skin around it. If you're not allergic to that particular pollen, there will be nothing on your skin. But if you are, the second picture that shows the redness there, and we measured that reaction. That's a positive reaction. Blood tests can be done too. However, skin tests are more accurate, or they pick up more allergens than blood test does. And then what should we do next? Now, we got diagnosed, we think this is allergies. Avoidance measures, very important, and I'll discuss those with you guys today. Medications, there are medications too. We'll discuss a little bit about that too. Immunotherapy, allergy shots, we'll just briefly go through that. Or Elon Musk's idea, let's move to space. So can't do that. That's too expensive. So why don't we just go through avoidance measures? So how do we avoid those? Dust mites, pollen, mold, pet dander. A little bit about dust mites. They're very small microorganisms. We cannot see them with our naked eye. They can only be seen under microscope. So what they do is they feed off of the skin that we shed. The skin we shed on a daily basis, that's their food. So they are where we are. So they make their residence where we spend most of our time, that 24-hour time period. That's our bedroom. 1/3 of our life is spent in our bedroom, sleeping on the beds. So that's where they make their residence. And they also like that cozy, nice, and warm, humid conditions. That's where they thrive. They like to be burrowed inside the fabric of our mattresses, of our pillows, duets, blankets. That becomes their residence. Underneath the carpets, in the draperies, upholstered furniture, in the stuffed animals, the stuffed animal toys that our kids have. The dust mites are in there too. So since they live in those places, that becomes their residence, that's where their food is. Obviously, they will poop there as well. It's their poop, their waste product. That is what that's what we inhale and are allergic to. We don't inhale dust mites. It's their poop. That is an allergen. That is what triggers allergies in us. it is known that average bed contains 2 million dust mites. That's how prevalent they are. So what do we do? What I would recommend, and what we recommend usually, is that high heat kills dust mites. Even freezing kills dust mite. Well, I think high heat is more practical. We should wash sheets, like fitted sheets, your pillow covers, weekly in hot water. And your blankets, even the duets, if you know that I'm highly allergic to dust mites, just keep an old comforter for daily use. And that can also go in high heat dryer. If you don't want to wash them every weekend, like your stuffed animals, your comforters, just put them in high heat dryer every weekend. You don't want to take away the stuffed animals from your kids. So just put them in high heat dryer every weekend. They can play again on them on a Monday for the whole week, and keep doing it every weekend. So with your comforters, even the pillows can be put in the high heat dryer. You can wash the blankets, or you can put them in a high heat dryer every weekend. And encasing your pillows and mattresses in dust mite proof covers. A lot of times what we see is that our patients tell us, yeah, I have a cover for my mattress. It's actually a mattress protectant. That is not a dust mite proof cover. But then say, no, it's not. The dust mite proof cover is different than your mattress protectant. So the mattress protectant will not protect you from dust mites. The dust mites will still cross through it and reach you. The dust mite proof cover feels like plastic. That's how you can differentiate. So you feel it. It feels like plastic. So the pore size of the fabric is extremely small of the dust mite proof covers. So dust mites don't cross through it. They can stay inside the mattress. Let them stay there. The other thing is that the dust mites, they thrive at temperatures between 68 to 84 degrees Fahrenheit. And they like the humidity from 56 to 80%. So try to keep the humidity in your homes below 55%. If it's humid, dust mites will thrive. Another important fact here, we usually see that when we see patients say, oh, my son, my daughter is so stuffy. And then what I did is I put a humidifier in the bedroom. I hope that helps. No, that's a big no. The humidifier in the bedroom is helping the dust mites thrive because they like it now. This is the environment they wanted, and they're going to multiply in millions. So do not do that. And minimizing carpets if that's practical. I know it's expensive. So now pollen. The pollen is a light, dry, powdery stuff that comes from trees, grasses, and weeds. And it can be carried to great distances by the wind. That's the problem in Dallas. Why do we have so much pollen here? It's so windy here. So we get pollen from even across the state. That pollen comes here too with this strong wind. And the other problem is it sticks easily to everything exposed to it. So you go out when you're going for a walk or something, you are just covered with pollen. Even your hair, the clothing, your pet is with you, you're taking your dog for a walk, the dog fur is full of pollen. So, and then you carry it indoors. You come inside with your shoes, with your clothes, on your pet, you carry the pollen inside. And before a heavy thunderstorm, if there is wind, it can bring in pollen in 1/2 hour, more than 24 hours of normal weather. That thunderstorm, heavy thunderstorm, and it's windy. If you are allergic, better not be outside. Rain usually cleanses the air of pollen, but after the rainstorm, what happens? The mold goes up. So an important fact there as well. So what do we do about this pollen? So if you know you have pollen allergies, don't keep your windows and doors open. Just try to close your windows and doors. And changing filters every 3 months. If you're in your car, don't leave the windows open. And if you did, then you run the air conditioning on recycle mode. So, try to cleanse the air. And if you have pollen allergies, let someone else do the yard work. But if you must, you can wear a painter's or a pollen mask that should be tightly fitted to your face so that you don't get exposed to the pollen. And if you are outdoors, you were doing yard work, or you were there for a walk, or your kids were playing outside, once we come indoors, what I would recommend is go straight to the shower. Just wash off the pollen, and those clothes that you are wearing should not be put in the laundry basket, because then you are carrying the pollen inside. They should go straight to the washer. Otherwise, you're carrying the pollen inside, and that keeps impacting you. And about the eyes, if your eyes get impacted a lot with pollen, you wear close-fitting sunglasses to decrease the pollen exposure to your eyes. And now that you are outdoors, you are not wearing the sunglasses or anything, now you're feeling like, okay, you're itchy. Do not rub your eyes, because then you're just making it go further inside. You can use some saline drops or artificial tears to wash out your eyes, and then the itching will stop. Or if you're wearing contact lenses, and then you go outside and now your eyes are itchy, and you try to rub when your contacts are in. No, bad idea. Take the lenses out and then clean your eyes with saline. That will help. And now, this is your pollen season. Try to take your preventive medicines on a daily basis, which is like your nasal spray, Flonase, over-the-counter nasal sprays, Nasoport. Try to take it daily if you know this is your pollen season. And you have on top of that an activity outdoors planned for the whole day. Your kid has a soccer game, or you have to be outdoors for the whole day. You can take an antihistamine that day on top of your nasal spray. And people who have allergies, who have constant seasonal allergies, they are very prone to get irritation from the fumes, like cigarette smoke. So a person who has allergies, they will get more impacted from that irritation from the smoke than a person who does not have allergies. So irritation really irritates their mucosa, the lining of their noses, inside lining of their noses. So try to avoid those strong smells, strong odors, strong perfumes, or cigarette smoke. Air filters, you can put an air filter, portable air filter in your rooms, in your bedrooms, if you have pets especially. And then maintain your AC and heating system regularly, changing filters. High efficiency particle air filters are most effective filters. The HEPA filters are most effective. And air duct cleaning is not mandatory if your ventilation system is not that dirty from neglect or age. It's not necessary. But if you have a vacuum cleaner, use a HEPA vacuum cleaner bags. And if you're using a window air conditioner, clean the filters regularly. That too, sometimes people have a window AC, not the centrally placed AC. So in that, what you can do is set the intake to draw air in only from inside the house, not the fresh air from outdoors. You don't want to bring pollen inside. And if you have furred animals, like your pet friends, your cats, dogs, if you can, keep them outside, but maybe keep them outside the bedroom if possible, and try to bathe them regularly, because like I said, you're bringing the pollen inside. When you take them outside, then you bring them inside, you're bringing pollen along with them. So that brings us to the pet. So pet dander, which is on your pet, and everything it touches. It stays airborne longer than pollen. So this is even worse. The pet dander stays airborne. It stays in the air for a longer time. And it's very sticky. The cat dander, so for example, if you have a cat and then you found out that you're getting wheezing, itchy nose and itchy runny nose because being around a cat, now you're trying to get rid of your cat. But the problem is the cat dander, even though you remove the cat dander is in your house for at least a few months after the cat is removed from the house. So it stays there for longer, even after the cat is removed from the environment. So vacuum frequently, bathe your pets frequently, and wash your hands after touching the pet. Keep your pets outside the bedroom, if not outside the house. Now mold. So mold is a fungus that you see sometimes a powdery growth It usually is in the damp areas of your home, for example, bathrooms. The mold can be outdoor as well as indoor. And indoor mold is usually seen around poor circulation areas, like around the areas where it was maybe flooded, plumbing leaks, indoor house plants, and under or around your aquarium. That's another point. You know, we have aquariums in the houses. Look around. There can be mold growth there as well. Outdoor mold is it collects usually around the decomposed leaves, like the leaves, the dead leaves that you see outside. So that accumulates a lot of mold. And then after the rain, there's a lot of mold collection because it helps the mold to grow. After rainstorms, the mold count goes up. And around the north side of your homes, because it's not well-lit side of your home, the north side. It's mostly damp. So you will see mold growth around that side of your house. And mold allergies, similar to pollen allergy, no different symptom, same as that we discussed just now. And the treatment is the same. However, it's not that seasonal. The mold allergies are not as seasonal as in the case of pollen. And people who are allergic to molds, they may have symptoms that persist for a longer period of time because they're exposed to it for a longer period of time. So what do we do? For outside the house, if you are working with leaves and grass, wear a mask. And after you do the yard work, you mowed your lawn, you did the trimming of your leaves, don't leave the leaves there. Remove them because once they die, let them die there. It's going to make, it's going to be good for my soil and stuff like that. No, this has to be removed because it's going to accumulate mold. So remove all dead or dying vegetation. That's the point. And sometimes we have those vines or shrubs that grow on the exterior walls of the house that can also accumulate mold. And keep the gutters clean. Also, those the gutters that we have outside the houses, the water they drain should be directed away from the foundation. If it directs towards your foundation, then you're trying to, that's building mold inside the house. And what do we do inside the house? You will see inside your houses, the windowsills and tracks around the windows. You can sometimes see mold there. So try to keep them clean. And refrigerator drip tray, look at that, keep that clean. Even the rubber gasket around your fridge, when you open the fridge door, you will see that there's a rubber around those doors. Mold accumulates there as well. Keep your garbage containers clean and dry. And check the AC for dampness around the vents and around that AC unit. And of course, change your filters every 3 months. And what else you can do is keep the bathroom walls, the floors, the tub tile, and shower curtain dry and clean, because more wetness in your bathroom, more mold will accumulate. And it's best not to have carpet inside your bathroom, the laundry room, other wet areas, because you're accumulating mold there. You can't dry it. You can't dry the carpet easily. And if you have dried plants and flowers inside the house, remove them. And if you have damp towels or clothing inside the house, try to dry them. Don't just leave them there. Just damp towels, that's also accumulating dampness inside the house. And dry your clothes thoroughly in the dryer. Don't leave them, don't get them out semi-dried. And the dryer has a vent. Every dryer has a vent. The vent should be outside the house. It should be directed outside the house, not inside. And if you have old newspapers, books, other papers, just put them in a plastic bag or outside the house. Every house mostly has those crawl spaces. Try to see if there is enough ventilation there, and check seasonally for, every so often for any dampness there. And of course, no-brainer, fix any roof leaks promptly. Just don't leave them there. And like I said, we will discuss a little bit about medications. So what are the usual medications that we use? Like I just discussed, the nasal steroid sprays. They're over the counter. Flonase, Nasacort, a few facts that you can learn for you to use those tricks on a day-to-day basis. That nasal steroid sprays, if you know that you have, for example, tree pollen allergies, so spring is your time, you will have to start using it 1 week before the season sets in, because it takes time for those preventive medicines to start acting, to start benefiting you. So start that 1 week ahead of the tree pollen season. Like we just discussed, the tree pollen mid-Feb, late Feb, it starts. So start from early Feb, your nasal spray, because that will give you protection during the winter. And how do you use the nasal spray? So it's very important. One important thing to note there is that when you put the nasal spray inside your nose, then you tilt it towards your eyes. So what I tell my patients, I tell them, remember cross sign. So if you use the nasal spray on your left nostril, use your right hand. And then once the nasal spray goes inside your nose, then tilt it towards left side. We don't want the nasal spray point straight or towards your middle of the nose. Not a good idea. It should point outwards, because that's where your sinuses are. They're on this side. And also, you don't want the nasal spray going on the middle of your nose. That's the septum. It can cause perforation of the septum. So it has to be directed outwards. That was something important for you guys to know. And antihistamines, use it more for as need basis. Your daily medicine is your nasal steroid spray. Antihistamine is your as needed medicine. And we have nasal antihistamines as well. You can use them as needed. Singular, you must have heard about Singular montelukast. It's a prescription medicine. We can use that as well. I'm a huge proponent of sinus rinses. Sinus rinses, that is a very good preventive measure during pollen seasons. So when you come from outdoors, when you're taking a shower, keep a sinus rinse in your shower as well. But use distilled water when you're doing sinus rinses. Do not use any other form of water in your sinus rinses other than distilled water, because distilled water is the purest form of water. When you use even the boiled water, it still is not the purest form of water. Why? Why do we want to use the purest form of water? Because I have to share this. Otherwise, the compliance goes down unless you know the reason. So nose has a connection with the brain. If we use any other form of water that still has some microbes in it, that can cause brain infection. So that's how important it is to use distilled form of water in the sinus rinses. And another point that I want to discuss is decongestants like Sudafed. Use it only for as needed basis. Do not use it on a daily basis, because it stimulates your heart. It increases the heart rate. It increases your blood pressure, and it doesn't do any good to the inflammation. It does not change the course of the disease. It's just a Band-Aid there, and a bad Band-Aid. So that, and then allergy shots and steroids. So steroid shots is also not a good way to treat your allergies. That is not an allergy shot. It's a misnomer. Steroid shot is not an allergy shot. So using steroid shots every season is not a good way of treating your allergies, because those steroids have side effects, and it does not cause that prevention that allergy shots do on a long-term basis. So what do we do in allergy shots? So what allergy shots have inside, they don't have steroids in them. They contain those allergens that you are allergic to. So what you were sensitive to on your skin test that we found out, that's what we mix. When we inject them into your system, the immune system responds by building a tolerance, by building a protective response against them. That results in decrease in your allergy symptoms whenever you have that exposure to those pollens. And this protective response, it develops slowly. It's not overnight, because it's not a steroid shot. It's not overnight, it develops slowly. However, it's more durable. The benefit of this is more durable. So when you're doing your allergy shots, within 6 to 8 months, you start developing tolerance to those pollens. Your symptoms are less and less with each approaching season. You feel like, okay, this year my spring wasn't as bad as last year. This year it's great. And each season is better. And then after a couple of years, it's even better. Allergy shots, and you do once a month. After those couple of years, you do once a month for 2-3 years. But when you're done, you're good for next 15 years. You don't have to worry. You have enough tolerance for those 10, 15 years. So it's a better way of treating your allergies than steroid shots. That's very important to remember. So that brings us to the end of our talk today. And I'll see if we have any questions. And then if we don't have time for all the questions, I have put my email address here. Please note that down and email me your questions. If after this presentation, you're like, oh, we forgot to ask her this, please do email me your questions. I'm happy to answer. So
Thank you, Dr. GHAZI. What a comprehensive and what an excellent lecture. Now we've got, a lot of doctors also join in. And kudos to you, pulmonology, internal medicine, and I as a pediatrician agree, we've all learned something that we were maybe not so clear of. A very thorough, very comprehensive talk, and we appreciate you taking the time out and helping us out today. I hope that we all learned a lot today, and that will enable us to understand the condition, ask the right questions when we see our doctors, and understand the management of allergies, which can impact our lives, especially if you're severely affected, eczema, nasal allergies, or asthma. One question that I have, there have not been any questions, just, a lot of compliments on how wonderful the lecture was, which I agree completely. When do you recommend, a question that I have, and I think that is a question that a lot of patients ask me as well, is for which patients do you recommend allergy testing?
So depends on the symptoms. If the symptoms are impairing the quality of their lives, the symptoms that I just described, if it's impacting their sinuses, they're having frequent ear infections, they can't sleep at night, and you feel like now they have developed asthma as well, absolutely get them tested. Absolutely. And at that time, they are good candidates for allergy immunotherapy, because at that time, you don't want the effect of allergies to progress and cause other diseases like asthma, eczema, and so on and so forth.
Thank you so much for your kind lecture, discussing not only the symptoms, prevention, in which, tells us how much of a difference as a patient we can, make. And that is a huge part of medicine that we especially strive for, is prevention and then treatment. So there's a lot that we understood that we can actually do ourselves at home to minimize our symptoms. And then obviously the treatment is there as well. So thank you very much for the lecture. One thing I would want to tell all the participants who are here is very kind of Dr. GHAZI to give her email address. So, absolutely, if you have any questions, go ahead and you can always write an email to her. This lecture is going to be available in the next day or two on our YouTube channel. And we'd highly recommend you go and see our site, AMWPA.org. is the YouTube channel where you can, watch this video. And if you have some friends or family members who suffer from allergies, asthma, or eczema, or you think might find this information helpful, please do share it with them. So there is one question that I see. How do I know what allergy do I have if no allergy testing is done?
Sure. So if you were present during the presentation, what we just said is that if your symptoms are seasonal, so your symptoms are only during certain seasons, during particular seasons. We just showed the slide that if it's just March, April, May, it could be your trees or grass allergies. And if your symptoms are all year round, it could be dust mite or mold. If your symptoms are just during fall, those symptoms that we just discussed, it could be your ragweed allergies. So then that's how you can figure out that you have allergies to that particular substance if you don't want to do the allergy testing.
There's another question, Dr. GHAZI, and it says, with COVID, how to differentiate the symptoms?
So same thing, like we discussed in the slide, that COVID is like any other viral infection. COVID is any other viral infection, no different as long as we see the runny nose and congestion and all that. So fever, we said fever, and the duration of your symptoms. If your symptoms are they have a seasonal trend, you had those symptoms last year too during the same season, it's more allergies than your regular COVID. Symptoms last for maybe a week or 10 days, the upper respiratory tract infection symptoms, the congestion, nasals, runny nose, and all that. And then eventually they stop. But allergies, they will persist. They will persist. And fever is one of the most important things that can differentiate. And itching is always allergies. Itching of your nose, itching of your throat, itching around your mouth, itching of your eyes.
Okay, so if anyone has any questions, please.
Should I put my email address back?
Mm-hmm. Yes, that's the email address here. And then we already told you about the YouTube channel. It's AMWPA.org. And for, a lot of students who are here today or younger generation, if you'd want to go on our site, www.amwpa.org, and you'll be able to know a little bit more about our organization. I do thank Dr. AASIA GHAZI today for joining, all the participants to increase our knowledge, which is a huge part of our responsibility because we learn some and we share it with others and improve our health. And thank you to AMWPA to again host another lecture in a series of lectures that we've done in the last few months to help learn a little bit more about common medical conditions and how to
Thank you, Dr.
improve our health.
Thank you, everyone.
Thank you, everyone, and assalamu alaikum.
Assalamu alaikum. Wa alaikum assalam. Assalamu alaikum.